Good.
Wow, you have 20 attendees in the waiting room already. That's pretty cool.
They are actually live. The webinar got
Oh,
started. Yeah, so just FYI.
oh no. Okay.
Yeah, that's fine. Do you guys have any questions or anything before we get started in just a couple minutes?
I'm okay.
Okay, perfect.
Thank you.
Okay, so
Yeah.
okay, good. Okay. Just housekeeping thing. So when we turn on the caption, and this is can be changed into Vietnamese, right?
Yes, it
Okay.
should be able to be
Yeah.
translated.
Okay. Okay. That's good. Yeah, that's fine. Yeah. Thank you.
Mhm. I'm not sure how accurate it will be, but I guess better than nothing.
Yeah. So after the meetings, can we get the demographics of the participants, roughly, like
We have
size?
some. Yeah,
Mhm.
we have some information. It's very basic. I think name, email,
Mhm.
maybe organization is collected.
I think it captures the transcript in English rather than translated.
So you can, I think you can change the settings. So you can
Yeah,
change, yeah. So you can
because
actually,
yeah. So I'm choosing my speaking language as Vietnamese, so it's still showing up English, and then when I change my speaking language into English, it's still showing English. So yeah. So the caption settings, right? Is
yeah, yeah. So some of it, the language is going, but it's not all. So
yeah.
it takes a minute to register. So you can see as it like comes through, um, it's adjusting.
Okay. Thank you.
Yeah. Yeah. The best thing to do is to do live translation, and have an interpreter join.
Oh, okay, I see.
Yeah. Okay. So looks like we are right at the top of the hour. So we can, let's see, I'll just give it 1 minute and give people a minute to join, and then we can go ahead and get started.
Recording in progress.
Welcome, everyone. Good morning, good evening, good afternoon, depending on where you are in the world today. We're happy to have you join us for this webinar, Hepatitis, Elimination in Action. We will be learning lessons from Vietnam's experience and the global implications for that experience. And we have a great esteemed panel of speakers that we'll be introducing shortly. But thank you all so much for joining. If you would like, as you're joining the session today, feel free to use the chat feature to introduce yourself. You can tell us where you're calling in from. That would be great. We would love to learn a little bit about our audience today. So this is an agenda of what we'll be covering. Obviously, welcome to everyone. We'll be discussing some housekeeping. We'll share a short bit about the Hepatitis B Foundation, discuss the key features of the presentation, and this will be followed by a panel discussion, Q&A, and a conclusion. And just for you all as well, my name is Catherine Freeland, and I'm the Associate Director of Public Health Research at the Hepatitis B Foundation, and I'm happy to be hosting this webinar with you all today. Just to do a bit of housekeeping for your participation in today's webinar, every attendee is in listen-only mode. You will be on mute throughout the duration of the session today. You can use the chat feature at any point. You can feel free to type in any questions in the chat feature, or you can use the question and answer feature by going to the Zoom Q&A section of your screen. And we'll do our best to answer any questions and address any comments that you have as well. Just for reference as well, this session is being recorded. It will be posted on our YouTube page for later viewing, and we'll be sharing the recording with all of the participants of today's session. And we hope that you can also share that with other colleagues that might find this information presented today relevant. Just a little bit about the Hepatitis B Foundation. I've got a QR code on this slide as well, if that's helpful to you, which takes you to our website, which is full of a ton of resources and public health materials and fact sheets and so forth related to hepatitis B. But we are a nonprofit organization that is dedicated to finding a cure and improving the quality of life for those affected by hepatitis B around the world. This commitment includes funding focused research, promoting disease awareness, supporting immunization and treatment initiatives, and serving as a primary source of information for patients and their families, the general medical and scientific community, and the public. We hope some of the information on our website and especially today's webinar will be helpful to you in your practice. So I'd like to jump right into today's session. I'm going to hand it over to Dr. Don Dao. He is an assistant professor of medicine and the director of the Center for Excellence for Liver Disease in Vietnam, Johns Hopkins School of Medicine, and the founder of the Vietnam Viral Hepatitis Alliance. He leads effort to advance comprehensive public health research and response strategies addressing significant liver cancer burdens caused by chronic hepatitis B in Vietnam. And he'll be telling us about some of that experience and practical public health practice in Vietnam today. So I'll hand it over to Dr. Dao, and he'll also be presenting and introducing the rest of our panelists today. So over to you.
Great. Hello, everyone. And thank you, Catherine, again, and the Hepatitis B Foundation for the opportunity to share our experience on hepatitis B eliminations in actions in Vietnam. And join me today, we have Associate Professor Đào Việt Hằng, who's a national expert in the area. She resides in Vietnam, and she will share firsthand experiences on the perspective from Vietnam. Hằng, would you like to say hello?
Hello everyone, I'm Hằng. I'm from Hanoi Medical University. Nice to see you all in this session.
Thank you. And others include Dr. Trang Pham and Amy Trang, who are key members of the team and implementers of the work that I will be presenting today. Already introduced and many more, which I attempt to acknowledge along the presentations. and I try to share with you as much as I can. Next slide, please. Liver cancer burdens is highest in East and Southeast Asia and Sub-Saharan Africa, as clearly shown in this global HCC burdens map. And superimposed on it is a hepatitis B, which is the leading cause of liver cancers in these high liver cancer burden regions. The overlapping between high hepatitis B prevalence and liver cancer incidence underlies why eliminating Hep B is essential for global cancer control. So that is to say, HPV elimination equal liver cancer prevention. And in fact, the WHO has a target to eliminate Hep B as a public health threat by 2030. With that said, though, the progress towards Hep B elimination globally has been slow, especially in the low to middle income countries, or LMIC. Next slide, please. So here you see the Vietnam's country, which is highlighted in red, and it is a low to middle income country and is home to approximately 100 million individuals with a high prevalence of hepatitis B. It was one of the first countries, in fact, in Southeast Asia to develop a national action plan for viral hepatitis prevention and control, with the first national action plan released in 2015, which is shown here. Despite the significant disease burdens, the linkage to care remains low, along with many people who are not diagnosed and thus untreated. Next slide. So these gaps, many people remains undiagnosed and untreated. That need to go beyond their acknowledging the disease burdens. So we needed to understand why these gaps exist and how to address them more effectively. And that really became one of our rationales for our work over the years. And that is to study the specific barriers in Hep B treatment and management in Vietnam, and then use these findings to guide targeted implementable solutions. So to determine the Vietnam-specific barriers to hepatitis B treatment and elimination, we focus on Ho Chi Minh City, a city with a diverse population of approximately 10 million individuals, and those individuals largely represent the Vietnam's populations. We targeted this city because we have built strong partnerships with the local governments, along with several other stakeholders. So our first step was to create a hepatitis B elimination framework for Ho Chi Minh City by accurately assessing the disease burden and identifying barriers to testing and eliminations. We use a public health approach. We selected 100 out of 320 communes across the 24 districts in Ho Chi Minh City to sample this 20,000 representative adults for the studies. And as you can see here on the left diagram or the map of Vietnam, and you zoom in is the map of Ho Chi Minh City with different colors. And the diagram on the right side illustrates the study sampling process, which I won't go into the details. One of the key contributors to this study is Associate Professor Hang Tang from the Phan Ngoại Tat School of Medicine in Ho Chi Minh City, who has graciously supported the project since its inception. Next slide, please. So here are some of the results regarding this Vietnam-specific barriers to hepatitis B treatment eliminations in Ho Chi Minh City. So on the left is the figure of Ho Chi Minh City once again, with different colors representing the rate of surface antigen of hepatitis B. across 24 districts in Ho Chi Minh City. And as you can see here, the darker color represents the higher rate. So on average, Ho Chi Minh City has about 7.5% prevalence of hepatitis B infection. And that ranges from 5.5% in districts with the lighter colors, let's say District 2, for example, to 17.5% of hepatitis B infection rates in other districts, for example, District 4. And the second figures on your right there highlights the poor linkage to care to hepatitis B in Ho Chi Minh City. And what I wanted to focus primarily on is, next slide, Catherine, is this second column on the diagram. And this column represents the number of people who were infected and discovered through the program. And here you can see that only 30% of those infected are really aware of their infection status. And of those who were diagnosed, so the 30% of people who were diagnosed through the program, majority of them, or 70% of them, were diagnosed only after developing complications of chronic hepatitis B infection, including cirrhosis and liver cancer. So let's pause there for 1 second. And this is important. I'd like to emphasize again that of the people who are living with hepatitis B in Ho Chi Minh City, only 30% of them are aware of their infections. And of the people who are aware of their infections, 70% of them got the diagnosis through only after they developed clinical symptoms from chronic hep B infections, including cirrhosis and liver cancer. So this suggests to us that there's a need, perhaps for Vietnam, to consider shifting from a clinical approach where people, are screened for hepatitis B mostly at the time of their clinical complications from the chronic infection, to perhaps a more proactive public health approach, considering implementing perhaps universal testing for Hep B, including those who are asymptomatic. So next slide, please. Additional challenges that we learn regarding Hep B elimination Vietnam include that a large proportion, approximately 38% of adults in Ho Chi Minh City are still susceptible to hepatitis B infection, and that means they are naive to all the hepatitis B serology. They've never been in contact with hepatitis B. Only 18.7% have been fully vaccinated. And we also found lack of provider training, limited access to testing, and poor use of point-of-care rapid testing for hepatitis B, especially in community and primary care levels. Next slide, please. So we like to share these images that we capture our screening and linkage to care efforts at a community health clinic in Ho Chi Minh City, to illustrate that hepatitis B elimination in actions at the community level. So to effectively characterize the population's Hep B profiles, we employ a comprehensive panel of 3 serologic testings for hepatitis B. And those serologic tests include one, HBsAg, to identify those who are actively living with hepatitis B in community. The second serologic testing is anti-HBs to detect immunity to Hep B. And the third serology is anti-core total antibody to reveal prior exposure to hepatitis B. So this full panel approach allowed us to not only turn in data into direct public health interventions on the ground. Next slide. Building on our early work and decentralized testing strategies, we launched the DetectB project. The acronym is explained on the slide. So this DetectB project integrated 3 key interventions. One, the provider education for hepatitis B, and in this case, providers, we focuses primarily on primary care providers. The second intervention is the point of care rapid testings, and the third is the best practice alerts or PPA. And those PPAs are embedded in electronic health records. So we implemented this DetectB project in a district level hospital in Ho Chi Minh City, Lavington Hospital. And this is to position primary care providers, primary care healthcare workers as frontline for hepatitis B eliminations. And again, the goal again is to ensure that timely testing and treatment with PPAs prompting providers and point of care rapid testing delivering the almost instant results for hepatitis B testing and then linkage to care. So this model shifts the hepatitis B management at the status quo from a hospital-based specialty system where mostly only symptomatic patients are seen to a more proactive public health approach in a community-based setting, a primary care clinic-based setting with universal testing approach embedded in an outpatient primary care department at a district level hospital. So its potential impact has been highlighted and documented in this publication by Kim Tan et al. In eClinical Medicine in 2024. And so that was on the publication and whether this in the real world effectiveness is being evaluated by this DetectB program that is being ongoing. And we anticipate to finish this project later this year. And key individuals performing this project is Dr. Tan Kim and Mrs. Dim Dao, whose pictures are shown on the slide. Next slide, please. So moving on to innovation and in interventions, put things in actions. So this slide and the next few slides are to highlight how community engagement and education efforts are important components of Hep B elimination and action. Through the initiatives like the Healthy Liver, Happy Lives campaign, we reach people where they live and work. We brought awareness and destigmatizations efforts directly into the community. Additionally, activities include health fairs and outreach and other programs we launched, for example, the National Liver Cancer Awareness Week in 2023, which together create a highly visible public presence, informing local public health policy makers and other key leaderships to engage them into this collective effort, Hep B elimination in Vietnam. Next slide, please. Specifically, this slide showcases the Healthy Liver, Happy Life Health Fair. And this is a public event that brought together healthcare workers, local authorities, and community members for a day of education, free screening, and hepatitis awareness. And once again, events like this are essential to building trust with the local stakeholders, reducing stigma among patients who are living with hepatitis B, and reaching those who might not be otherwise have access to hepatitis B testing and care. Next slide. So this slide highlights another important component of our efforts towards Hep B elimination and action in Vietnam, and that is to empower primary care providers. through the project HEP, HELP, or Health Education for Liver Providers in Vietnam. We are providing CME accredited training in collaborations with Phan Ngọc Thạch University of Medicine. The focus here is to strengthen frontline capacity by equipping these primary care providers, frontline healthcare workers with the knowledge and tools to identify individual at risk for hepatitis B and provide the testing. Subsequently provide the linkage to care informations, and these efforts are especially important and vital in district level and community clinics where access to specialists is often limited. Next slide, please. So I'm getting to the an end here. With this effort, and I like to show that our experience shows that hepatitis B elimination in Vietnam can be achievable when it's grounded in the local ownership, primary care interventions, and community engagement. And some of the lessons that we have learned include perhaps consider a shift from relying on specialty clinics for testing and management to a more proactive public health approach where hepatitis B care, screening, diagnosis, and education can be integrated into primary care and community settings, and making these services more accessible and perhaps more universal and preventive. Multi-stakeholder collaborations is also critical, from governments to grassroots community organizations. Decentralizing care using point-of-care rapid tests. We have done a study in collaboration with Dr. Hong Dao on this, and the result I didn't show on the slide, but these tools are widely available in Vietnam and can be feasible to implement in primary care settings in Vietnam to improve access and equity. Educating providers and engaging communities, building trust, really drives a lot of actions in our efforts. And perhaps the Vietnam approach offers a scalable model for other countries, especially in Asia and Africa, and really turning the WHO strategies, the national strategies into action. With that, I wanted to end the presentation by acknowledging all of our partners who made this work possible. So in Vietnam, the Vietnam Viral Hepatitis Alliance, the Ho Chi Minh City Department of Health, Lovington Hospital, and Phan Ngọc Thạch University of Medicine, along with the Institute of Gastro and Hepatology in Hanoi. Our collaborators from Johns Hopkins and other organizations, and our funders, including the Hepatitis B Foundation, along with other private industries and donors. And most importantly, we thank the providers, the patients, the communities who really brought the hepatitis B elimination in action. So thank you again for the opportunity to share in our experiences.
Thank you so much for that excellent presentation. I think I did have a couple of questions, and I saw some come through as well. You mentioned a lot about partnerships. I wonder if, and this is for the entire group as well, so whoever is most appropriate to take these questions, Dr. Dao, feel free to direct people as you see appropriate. But I wonder if you could speak to the importance of the government partnership and how you were able to secure that partnership and their buy-in. I think that might be helpful for others to hear as they continue thinking about elimination strategies in their respective areas.
Great questions, Catherine. I wanted to direct this question to Lily and Amy and Isai, and would like to hear also from Hang Dao, who's on the ground in Viet. He does have a lot of experience.
Thank you, Dr. Zhao. So in terms of creating a partnership with the local government, actually, first we need some knowledge about the situation at the field. So I was born and raised in Vietnam, and I graduated from medical university over there and worked for several years over there. So I know the system, so I know some key person. And also with Dr. Dow, he has some collaborated in the past with people in Vietnam, like professionals in Vietnam. So this is those of like the very first idea that how we can come up with how we can collaborate with the Vietnam side. So later in our collaboration, we met with some of the Vietnam authority, and because that is the way that we need to go formally and also legally to set a partnership. It's not about personal relationship. It's about how to pave a legal way in a formal way so that we can step on that to provide our support and also to help our organization and also to collaborate further with the Vietnam side experts and also professionals. So in terms of partnership, I think that it's not just about with the public side, but also with the private side. So the partnership here, we're not looking just in the public, but we also look at the private sides because there is some sensitive kind of issue related to financial that with the public and partnership within Vietnam would facilitate the work. So by partnership with public and private, domestic and international, we have create a stronger bridge to help us to work further. And we're starting up at Ho Chi Minh City, and then we go further and collaborate with the Hanoi side, with Dr. Dow, Dr. Hang Dow. Yeah, and I think our key person from the state is like Amy is helping us with other like official and legally status in the state so that we can register in Vietnam. And then from that point to forward, we can start working legally and strongly with the Vietnam side.
Thank you. Anybody else have anything to add to that?
Yeah, and then I'll let Dr. Hung Dao also chime in on the Vietnam side. But just as Dr. Pham was saying, I think the most important thing to keep in mind if you are a nonprofit entity in the United States and you want to go to Vietnam to do the kind of work that we have done, the public-private partnership is so important. And just like Dr. Pham said, just as you would in the United States have to go through the legal process of establishing yourself and building credibility and working with key entities using the a legitimate and transparent method, we had to do the same in Vietnam. So establishing our 501c3 in the US and then applying for an NGO, official NGO status in Vietnam through their Department of State. And then on an annual basis, we get scrutinized on both ends, the US and in Vietnam, because money is being exchanged. So tax filed on both sides. And that's how we've been able to operate in the last 10 years in Vietnam and the US.
Yes, so so can I add several comments? So
Yes.
I'm from the local side. I study and graduate and work as a physician in Vietnam after graduating. So I think the perspective I see as a doctor, a local doctor, is a little different, because we are the one who see the real situation. We saw the gap between the testing strategy, and we saw the advanced stage patient who come the first time and they are diagnosed with SCC, advanced stage, or liver cirrhosis. So when we saw many situations like that, and when we saw the lack of the involvement of the insurance. For example, HPV, there are still a lot of difficulty for affording drugs for 100% covered by insurance. Or we don't have the national screening for HCC for the HPV patients, something like that. So when we saw the big gap like it, the question for the doctors or the physicians in different levels, the specialists or the primary care or the family doctors, will be how to shorten the gap and how to involve the government or the department or the Ministry of Health to know about this situation. So there are several ways to approach. First, I think the role of the professional organization is very important, because when the Ministry of Health want to build up the guideline, so the next step will be the involvement of the insurance for the guideline to help the patients to be covered. And that is why the tropical disease doctor or the hepatology doctors, the KOLs in such kind of field from the organizations are also the one who try to build up a practical guideline for our own country. So that is the first point. We want to have the impact on the policy for the patients. The second thing is that I think the partnership, as the previous panelists have mentioned, not only private and public, not only the policy and the medical healthcare providers or the patients or the family, but I think we should see about it as an ecosystem. I have learned from another program working with the pharmacist that in Vietnam, many patients going to the drugstore with the OTC, they want to buy the medicines to reduce the liver enzymes. So they build up a program to train for thousands of the pharmacists, the local pharmacists, to promote the pop rapid test for the pharmacists, because when the patient come, they can ask and then they will advise the patient and the family members of the patient to check for viral hepatitis B. So that is what make me feel like, oh yes, we are only see the patient at the advanced or intermediate stage when everything is very, very clear. But what we can do is that collaborating with other field, other sector that can screening in the much earlier phase. And pharmacy sector, I think, is also a very important key point in the ecosystem that somehow we miss that piece. And the third point I want to share is that even we have the document, the official document, we have the program, the campaign from the Ministry of Health. But when we go back to the primary care level, I have checked with the 5 different Department of Health in the 5 different cities, whether they have the data of viral hepatitis in their province. And the answer is no. And then when I come to the lower level, in the village or in the district level, they have the capacity to check for viral hepatitis B and viral hepatitis C, but they have no record in their system. So there is something lacking there about the database of the viral hepatitis in the primary care level. And as we know that WHO is really trying to expand the indication and to implement the capacity of the primary care level, so more patients can approach the treatment in the primary care level. But when we look back to the real situation, our local staff even don't have the data on how many patients they have each day and how many patients linked to care and how is the pathway of the patients. Even they have the capacity to test for the patient. So that is something we have to think about, how to make a practical model, something that the primary care level can do as a basic procedure, as a basic protocol. And I think it is feasible. The only way is how we implement to structure it in the way that they feel really feasible.
One other thing I wanted to add is this national action plan for viral hepatitis prevention and control really is a key document that we learn, suggesting, at the central level of government of Vietnam, they acknowledge this disease burdens and the feasibility of eliminating it. So, that's why we were hoping to be a catalyst to translate to whatever action plans they propose from the protocol into reality.
Thank you. That was really helpful. And I heard a lot of really important themes from all of the comments from the panelists, from partnership and the importance of both public and private, the importance of education. And then I really appreciated the comments about decentralization and thinking about how we translate specialty care into primary care. I wonder if we can highlight this a little bit, because I think this is something that we're talking about globally as a really important factor, because we have huge gaps in the people that are actually aware of their infection for hepatitis B specifically. So I wonder if you can talk about strategies for how we can continue to work to address that from both your specific context, your experiences that you've seen, because we have a big gap to address in Vietnam and then globally as well. I wonder, Dr. Dow, if you want to direct panelists or if somebody has a preference.
Yeah, a great question. This is something that we've been collaborating, working on with our partners in Vietnam. And I can outline a few challenges, but I think it would be really helpful to hear, especially from Dr. Hong Dao here, who's on ground. In the earlier, we mentioned about the insurance reimbursement policies for hepatitis B testing in asymptomatic or general population is not currently reimbursed in Vietnam. But how to make it reimbursable, and whether the country has the budget to do all of that is still, something we need to learn more. So insurance reimbursement policies. And I think Dr. Hang Dao mentioned about the fragmented care pathways, where people come to clinic, get the screen, but the records keeping can be not adequate or suboptimal, and therefore linkage to care after that, where the patient follow-up, linked to care, vaccinating, etc., is not optimal there. PCP knowledge and skills in recognizing individual at high risk or to screen for, and how to interpret the results and link them to care appropriately is another thing that can be improved upon. And as I mentioned earlier, the program like the HELP program, the HELP program, can somewhat improve that area. And I personally, I'm a clinician by background as well, and I do treat several Vietnamese patients from Vietnam and other patients in the U.S. And I know that the stigma from their perspective is huge. Oftentimes I ask them to share their personal stories for, to make the disease be more aware, and they usually don't want to share because of the stigma that they have. So education can help alleviate that stigmatizations. So again, the insurance reimbursement policy, the data, the tracking data can be really fragmented. PCP knowledge and skills are suboptimal in our experience, and the disease stigma are some of the challenges that I think can be addressed, and so that you can decentralize the care further. So with that, Hang, do you have any other comments on this?
Yes, so I really want to add on as I totally agree that decentralization is very important because it will reduce a lot of the workload for the upper level of the healthcare system. And I have several experience in Vietnam that I want to share with all of you. The first project I know is the projects regarding to Viet. So Viet has several projects in Vietnam for pilot in decentralization. They have 5 or 6 primary care level model that they have set up in Phú Thọ and Thái Nguyên province, the northern province in Vietnam. And what they are trying to do is that they want to have the primary care level side to build up a liver care unit, especially for HBV, and they want to see how good that the primary care level can manage the HBV patients. And the second project I know is that they are trying to build up a registry database of HBV, and they sign with the MOH to pilot in 6 or 7 hospitals, and then to see whether the hospitals feel feasible to integrate and then expand it in the bigger scale. But after that pilot study, the problem in Vietnam is that each hospital will use their own electronic medical record system, and they don't want to integrate into one system for one kind of disease. They want to use their own electronic medical record system to guarantee the data security. So I think for the second project, somehow it is stuck. But when discussing with the people around that issue, I find out that maybe there are several other ways we can do. So our team choose to approach the patient because we think the patient is the center of the ecosystem. And when the patient have the right to share their data with the healthcare providers. So that is why we build up a smartphone app for the HBV patients. And we call the app has the name HBV Care. It is already available in App Store for iPhone and for Android already. So there are several functions of the app, like reminding the time the patient need follow-up, giving the details of the surrounding medical sites that they can link to care, giving the educational package for the patients. And one very important function is to store the data. It means because in Vietnam, somehow the patients don't remember the time to follow up, but when they go to the medical site, they can go to the different medical sites and they don't keep the result of each time they go to see the doctors. So when you see the patients like that, it is very, very difficult to evaluate what is the period and how progressed along the time, and how to evaluate how to stratify the risk of the complications of the patient, and how to follow up the treatment, something like that. So in this app, the patient only need to take the photo of the result, the test, and then it is transferred automatically into the number and the text that store on the data for them. And every time they go, even they go to the new medical science or they go to see the new doctor, they can share such kind of data to their doctors. So we hope that it is one way the patient will feel more actively involved in their journey of management HBV. And we also hope that it will be helpful for the doctors to understand about the journey of the patient, even that they didn't know the past history of the patient. So I think that now in Vietnam, there are several ways that we can do, and there are still many other ways we can do. But every project is still ongoing. So maybe it will need more time, 2 or 3 years, to see how it is really like the real impact in the real situation of the different primary care level. Is it helpful or not? So what I have tried to do in real real world. So I hope in the next 2 or 3 years we will have some more experience to share with you. Yeah, thank you.
Great.
I also want to add a really important part, Catherine. That is the component of the language exchange and the cultural competency. That is so key in this public-private partnership that we have. For me, myself, I was born in Vietnam and raised in the United States since I was 1. So my colleagues here have taught me a whole lot of things about, the language, the culture, the word choices. And even though I spoke Vietnamese fluently in the United States, it's a different set of vocabulary words. So working in Vietnam, I had to learn everything from scratch. And my colleagues here were very generous with their time. And I think that is really important to point out, as well as their further studies in the United States and at conferences around the world. They have to rely on English, but then they also have to go through the process of dissecting that and saying, is this appropriate for us to utilize in Vietnam? And how do we present it in a way using proper word choices that do not offend our patients that we're trying to work with.
That's good, really good thoughts, Emmy. Even me, I was born and raised in Vietnam and relocated to the US when I was in adolescence, but I needed to relearn almost everything working there. Go ahead, Catherine. Any further questions?
Sure.
Mhm.
Yeah, definitely. So thank you for sharing. And I think the app that you were mentioning as a helpful tool to help with linkage to care and also data collection sounds really interesting. So I hope that maybe when the results from that can come out, we can do another session and share about this digital tool and how it could potentially be applicable to other settings. Because I think that linkage to care is so important. And I think we've had a lot of conversation in the field recently about the complexity of the guidelines and how it makes things really complicated for patients in terms of understanding their care journey and what they need to do to make sure that they're following up appropriately. I think a couple of folks touched on stigma being really a factor that influences health. I wonder if someone could tell us a little bit about the stigma implications in Vietnam and strategies that you might be able to use that help to address that stigma as well.
Great questions. I can only speak from my personal experience. Though to my knowledge, I don't think we have a lot of data regarding the population-based stigma. Like I shared earlier, so many of my patients usually don't want to share their happy status to the public or into their family members. And I think ways to go about that is to educate and educate at the individual level, at the system level, and even in the public at the public level. So with that, I like to hear other panelists' thoughts on this as well.
So I can chime in on this. When I work in Vietnam for our project, so this is a story about how they see HPV and the stigma about that. So when I talk with one potential funder, I asked like for our project and how we can do some fundraising, and I got one response that HPV is related to not irresponsible lifestyle. You drink. So the knowledge and how people see HPV in Vietnam is not about calling is this HPV, is this hepatitis. In Vietnam, viêm gan is a hepatitis, and because of anything related to the liver, it's mostly come from the beer, the alcoholic things. And Vietnam, you can know that is like the top 3 country with the most alcohol consumption. So this is a really important conception, a perception for peoples out there. And another thing is that the stigma is mostly because of the lifestyle and the disease. And another thing is, they know that hepatitis will gradually lead to liver cancer. However, they think that it's because of the lifestyle rather than the virus. And another thing is that the stigma is mostly seen in the women of reproductive age, so who are pregnant women, because back then I was the obstetrician. So I met one patient who really actually not one or two patients, but because I did some interview with the patient in the pregnant period, so the pregnancy period, and she shared with me that she feels guilty because she bear the virus in her body, and that transmitted to her offspring. However, she did not blame it to her partner or others, but she said, that is the bad luck of myself to get that one. It's not the real stigma. Like, I don't want to say this because it's related to other stuff, but it's because, like, as a mother nature. And she think that HPV is related to how she transmitted to her baby. Yeah. So do you have anything to add more?
I will add on the patient side. So I'm a patient advocate because my paternal grandmother passed away almost 20 years ago of Hep B and C. And at that time, the family didn't see it as a stigma, but more of a lack of information or knowledge about what hepatitis is. So we only understood it as a liver disease. Her liver wasn't well. She wasn't, functioning well. And that's the cause of her death. And so that's all we really knew. And it wasn't until like 5 or 6 years after she passed away that I started learning more about what hepatitis is. And at that time, when my grandmother passed away, I was already doing my doctorate program. So it wasn't a situation where, I wasn't educated enough. It was a situation where family members didn't really see it as a huge risk and didn't dig further into understanding whether or not they were at risk. And so later on, when I had an opportunity to learn more about it, it was another opportunity for me to talk to family members, ask them if they've got tested, and help them understand, what their levels may be. Some of them were just carriers, something minor. And we still don't know how she may have gotten hepatitis B or C, because she was not in a category that many people would say high risk. She doesn't drink, she doesn't do drugs, and the only thing that we could possibly think of is maybe it was her being infected at birth, because our family has roots going back to Fujian, China, which has a really high hepatitis rate, especially in B. And so that's, the only knowledge that we have of the possibility of how this may have transmitted to my grandmother who passed away. So I would say, on the patient level, there are still many patients that don't see a stigma at all because they don't really fully understand the disease.
Mm.
Yes, that is true. I agree with Lily and Amy, because I must admit that as a doctor in Vietnam with an overloading number of patients, I really don't have enough knowledge about the stigma of the patients. And in fact, in Vietnam, when I checked, I saw that regarding to HIV or STD disease, I think there are many tools that help the doctors to identify the stigma of the patients. But for HBV, we do not have such kind of tool that we know that is really effective in Asian populations. So from last year, there is one colleague of mine who worked with Lily also. She started a thesis, master thesis on stigma of HBV patients in Vietnam, and that is the first time I get used to the terminology and the new concepts of the stigma in HBV area. And I find out that even when, for both the doctors, but also for the patients, when doing the interview, there is also very many like debating in understanding correctly, especially in the terminology, because it is not a common concept for the patients. So I think in our population now, the one who feel take care and who have the most vulnerable feeling is the pregnant woman, because they are very afraid of transmitting the virus to their child. But for other population, they don't have the concept, or some of them have the concept, some of them even don't really have such kind of concept. And it is also for the doctors, because if we receive the question from the patient, we will find the problem is significant. But because maybe there are other problems that is more significant, like about the treatment strategy, linked to care strategy, or screening for liver cancer, something like that. So maybe somehow we under-evaluate the importance of identifying stigma. But I think it is something we should pay attention. And we really hope that after the thesis of our colleague, we will have some validating tool that we can use, and we can identify the problem. And we must know the prevalence that the patient have suffered in real situations. So then the doctors will pay more attention to this issue. Yeah.
Great. Catherine, I think we have a minute or two, I guess. Can we ask you a question though?
Sure.
Yeah. We share with you these interventions in Vietnam, the HEP program, the point of care rapid testing, community outreach, and various research studies, implementation studies. And I also know the Happy Foundation is a global reach organization, and you've been working in the area in other countries, in Africa, etc. Do you see any adaptability from our programs or the intervention I mentioned earlier to other countries, especially in Africa or the global South, if you would?
Yeah, thank you. I think that's a really important question. And I think we can all learn from each other in a variety of ways, because when we're talking about the root of the problem, the same themes continue to emerge. The same theme of we need to improve testing across the board is a challenge. And so the strategies that you've applied and that you're working to apply for decentralization, for partnering with ministry, for figuring out how to include within your insurance schemes, how to incorporate those services for hepatitis B patients are very applicable in other settings. We've been working in Nigeria on some of those exact issues. So I think lessons learned are completely applicable, and we can certainly learn from each other, and different unique innovative strategies like the app that you mentioned for helping with linkage to care. Tools like that certainly could be used in other settings. I think that would be something that our Nigerian colleagues or our other colleagues across the globe might be interested in learning from, because it might be relevant in their setting. I think also the conversations that were just being had about stigma and shame and pregnant women who are diagnosed with hepatitis B and the guilt that they feel. I think that guilt extends beyond just pregnant people. I think a lot of people feel that, and they feel afraid to transmit onto loved ones and family members. And so I also think that line of the need for education to address some of those challenges, and kind of making sure people understand that they didn't do anything wrong to get hepatitis B, and they can live a long, healthy life. They just need to make sure they're taking care of themselves with hepatitis B. So I think those messages need to be shared broadly to the community. And also, I think it was mentioned as well, there's stigma externally among partners that we also have to address. So there's all kinds of things, and these themes are all consistent really globally in terms of the things that need to be addressed in hepatitis B. So yeah, I think that would be my answer, and we can certainly learn from each other. And I learned from this chat, this conversation today, and I've learned from others. The more that you work with others, the more you learn, and I think the more we can work together to make positive change and work towards elimination.
Great, thank you.
Thank you too. My last question, and then we can end. I would love to hear what your plans, your next steps are for moving this forward, and everything that you shared today. And hopefully we can have some follow-up conversations with others so we can continue to learn from each other.
Yeah, thank you. This is important questions, and it's always on our minds, to be honest with you, and how to sustain the program and possibly expand it. So our next steps would be, and again, Emmy and Lily, and to some extent Hang Dao can chime in as well. For the detect program that I mentioned, if we find if we learn that the interventions are effective, and we could find funding, and that's something we could scale up to other hospitals, to other regions in Vietnam. And again, I wanted to acknowledge key individuals in doing that, and I see Tan Kim is in the audience here, along with Lily. So they are among the key individuals to move this project forward. So the Detect B project. Secondly, and this is what we focus in the South, and I'm pleased to learn that the High VN group is also focusing on doing it in the north of Vietnam. And in Vietnam, the South and the North can be different, and we hope to learn from each other as well. And that is to integrate these interventions that I mentioned: point of care rapid test, CME accredited curriculum, and then PPA, and the data tracking in areas in southern Vietnam, and hopefully we can link them together. So that's our next endeavor. And thirdly, we also wanted to focus on liver cancer early detection by surveillance methods. We do have longitudinal cohorts of patients with Hep B who are by definition are at risk of developing liver cancers, and we track these patients over time to learn what would be the most effective strategy to screen to detect liver cancer early. And along these studies, we also collect and archive biosamples, and we also do research biomarkers for early liver cancer detections as well. So the Detect B scalability potentially, and then data integration and tracking, and then liver cancer early detections. So those are major activities. And every once in a while, we do various conferences, health fairs, and other webinars like this, trying to raise the awareness altogether. Thank you.
Thank you so much.
Anything
Well,
else? Sorry,
yeah.
Catherine, Emmy, I think she's really good at finding funding. So maybe you have any insights and helping that.
I actually have to ask the audience and anybody who potentially might be watching this recording later is, please help us achieve the goal that we have. And we do want elimination by 2030 in Vietnam. It's doable because the cost of living in Vietnam is significantly low. So, you know, a few dollars stretches a long way in Vietnam. And, you know, that is our hope, that one day hepatitis B and C would be eliminated in Vietnam.
See, I'm telling you, she's good at that.
Great. Thank you so much. So I think we are over time. Sorry for that for everybody, but I think we wanted to definitely learn the next steps. And I think this is a great jumping off point for joining us and taking the time out of their busy schedules to be with us today. I look forward to sharing the recording with everyone, and I hope that you all have a wonderful rest of your day. Thank you all so much.
Thank you all
Thank
again.
Thank you.
Thanks,
Bye-bye.
everybody. Bye.
Bye.
Take care.
Bye.
Recording stop.